Welcome, everyone. Thank you for joining us today for the Talk with an Expert Q&A session, specifically focused on the COVID-19 vaccine and fertility and pregnancy. Today, we have Dr. Julie Greenwalt, a radiation oncologist at Baptist MD Anderson Cancer Center, and Dr. Kathryn Villano, maternal and fetal medicine specialist at Baptist Health, here to share their experience, questions they're receiving from patients, and answer any questions that you may have about the COVID-19 vaccine. I will let them introduce themselves, and then Dr. Greenwalt is going to talk a little bit about her decision to get the vaccine, and we will then hop into your questions. I'll give you a chance to unmute and ask your questions via audio if you're calling in on the phone. And if you're on the computer, you can submit questions via chat, and I will read those out to our doctors here today. So thank you again, everyone who's joining us. And thank you again, Drs. Bolano and Greenwalt. So Dr. Bolano, I'll start with you and let you introduce yourself. Tell us a little bit about you.
Sure. Thanks, Wesley. My name is Kathryn Villano. I'm one of the maternal fetal medicine doctors here at Baptist Downtown, and I work throughout the system to help take care of our moms with special medical problems or babies that have special needs in pregnancy as well. So I may see a lot of you guys in and around the system, and it's my pleasure to be here today.
Perfect. Thank you so much. Dr. Greenwalt?
Yes, thank you so much. My name is Julie Greenwalt. I'm a radiation oncologist over here at Baptist MD Anderson, which means I treat cancer patients with radiation therapy. I think more importantly, applicable on this call is that I am a mom of 3 small children, 5, 3, and 1. And I was actually pregnant when COVID-19 outbreak started. I delivered a baby in March of 2020. I literally have a COVID baby, was breastfeeding after that, and essentially was thrown into the mix, as many of my healthcare colleagues were, of a pandemic that none of us learned about in medical school. And so I just want to start by saying thank you for being here and giving up your time to listen and to discuss. I think this is a very, very, very important topic this week, especially in our area, as our hospital numbers are going up with young people. I personally have friends on a ventilator right now. So for those of you that also have friends on a ventilator or have lost loved ones to COVID, let me just start by saying I'm sorry. I'm sorry that this has affected all of us in ways that, you know, we can't put into words, but just wanted to thank you for being here. I offered to do this because I thought it was really important for my colleagues, my young females, to hear from another young female who struggled with this decision personally. I love being a mother. I personally had fertility struggles myself. I did actually was diagnosed with cancer and had to go through a lot of fertility treatments to become a mother myself. So I always tell my patients that one of the hardest things for me in my journey was actually the fertility struggles. Long before COVID arrived, I was, you know, an infertile patient myself. And so, believe it or not, battling cancer was difficult, but actually battling infertility was even harder. And so, you know, this is a topic near and dear to my heart, and one I really wanted to make sure we addressed for you. So first off, when I had to make this decision was December. So when the vaccines first came out, they got emergency use, and the word came through. All of us in the hospital were so excited to hear that they were coming, but then the word came through that, oh, the choice is here. We had about a week notice to decide if we were going to get the vaccine, and there was a lot of anxiety, a lot of discussion. So I personally had to make the decision, obviously, for myself. And at the time when I had to make the decision, the COVID and the Pfizer and the Moderna trials had just literally been released in November. And so I decided to spend the entire night doing what I love to do, because I have to do research for my specialty anyways, researching the trials. I literally read both 47-page documents on the entire trial for both the Pfizer and the Moderna vaccine. And I felt like I needed to read every single patient that went through the study and what their outcomes were, how they did, because at the time, COVID was mostly affecting people over the age of 65. I wasn't, thankfully, at that time on the front lines, intubating patients. And so at the time, I was trying to make a decision, do I get it now or do I wait? Because, in 6 months, we could know a lot more. However, my chance to get the vaccine is now. And so I need to do my research to make this decision for myself. So again, I spent about 4.5 hours. I begged my husband for alone mom time to read the studies. And what I found was that vaccination complication rates were extremely, extremely, extremely low. There was 44,000 patients in the Pfizer trial. There was about 32,000 in the Moderna trial. The death rate, if you actually look at it in a phase 3 trial, there's always going to be people that die when you look at any study because natural events happen, car accidents, heart attack, stroke, was actually higher in both the placebo arms. So if you actually look at the original Pfizer trial, there's, again, you can Google it, 6 people died on the trial and it created all this hysteria. Well, it turns out 4 of the people that died in the trial died in the placebo arm, means they got nothing. The other 2 people died in the trial arm of heart attacks. Again, one was about 48 days after the second dose, one was a couple days after, and both had full investigations, and none were related to the vaccine. Both had significant coronary artery disease. So when I read these studies and I read the trials, I felt much better. However, there's still a decision that has to be made for yourself. At the time I was making the decision, I think these rumors about infertility and all didn't exist as much, although they were starting to. But I made the brave decision after reading everything for myself that I was going to get the vaccine when I read that it was safe. The complication rate was less than 1% by a long shot, and that the chance of me dying from COVID was still about 1.8 to 2%. Because keeping in mind that COVID, unfortunately, picks and chooses people, and unfortunately, we don't know why, but some people's lungs don't recover. Some people's lungs, unfortunately, don't even make it on the ventilator, and we unfortunately have seen people as young as myself and even younger pass away of COVID. And so I felt like a 2% rate of death from a virus that I would essentially get exposed to in my job and take care of patients eventually versus a less than 0.0001% chance of a complication from the vaccine was worth it. So for me, it was a statistical game. However, I then had to make the decision for my own family members, right? My 90-year-old grandmother was then up for it, my own mother who has autoimmune disease and who has a history of anaphylaxis. So again, I literally pulled almost every single paper and tried to become my own self-expert because these people were relying on me, right? I never had patients, and I mean, I've had patients rely on me, don't get me wrong, but my own family members, every single person. Well, I have this and this comorbidity and this and this and this. Well, do I get the vaccine or not? So I personally read through all the data and ended up concluding that it was much, much, much safer to get the vaccine than it was to risk COVID. And especially with young children, I am very thankful that I made that decision. So I wanted to start with that as an introduction to share with you. I really struggled with the decision myself, but I'm very thankful. The vaccine, thankfully, to this point, I have not had COVID, nor has anybody in my family, including my child who was in school all year. And so I'm very thankful for the vaccine. And I really think we should engage and talk about some of the rumors out there so you guys can understand that a lot of them are just rumors and they are not scientifically proven. In fact, the opposite. There was actually 23 women who on the original Pfizer trial were told not to get pregnant. So when you signed up for the original trial, they said, listen, we need you to be on birth control. We need you to not be breastfeeding. We need you to not be pregnant. And we need you to not get pregnant because, again, this is a phase 3 trial, right? So we're testing out this drug. 23 women still got pregnant. Do you know that there was not one single pregnancy lost in any of the pregnant patients who got the vaccine? So number one, showing that they were still fertile getting the vaccine. Number two, the only miscarriages that happened, thankfully, in both trials happened in the placebo arm, which means they didn't get the vaccine. And so even more data has come out. I mean, you guys are making it much more informed decision than I am. When I made the decision, there was 44,000 people versus 32,000 people. Now in the U.S., there is millions of people who have gotten vaccinated. And I read today, over 3 billion people in the world have gotten the vaccine. So I'm so thankful we have one of our own fertility specialists on to speak to that too. And we really want to just engage your questions and try to explain to you that this vaccine very much will save your life or somebody you love.
Perfect. Thank you so much, Dr. Greenwalt. I think that's really powerful, and I do appreciate you sharing that about yourself and all you're doing to help everyone around you understand their research. So thank you. Dr. Villano, what would you say is the biggest question you're hearing vaccine hesitancy from women that you encounter in patients? Yeah.
That's a great question. And what I do in my practice every day is take care of women with high-risk pregnancies. So all my patients are curious about, is it safe in pregnancy? What's the data looking like for that? And we actually have some pretty good data on that, both from the trials, as Dr. Greenwalt mentioned, but also from an ongoing monitoring system that we are using here in the United States called VSafe. So at this point, we have over 124,000 women who were vaccinated while pregnant reporting into the VSafe registry, which means they have the ability to report in, are they having side effects from the vaccine? Are they having any complications in pregnancy? What type of complications we're seeing? And the data looks really, really good. As far as side effects go, we know that there are always adverse reactions and side effects that are possible from vaccination. We know that when you get the first shot, you tend to do well. When you get the second shot, you tend to have more of those side effects, more body aches, little fatigue, sometimes a low-grade temp. And those are signs that your immune system is activating and creating that protective bubble around you. So those are to be expected. We don't see them in all patients, but we aren't surprised when we see them, especially after the second vaccine. What's interesting is that our pregnant patients experience those symptoms less so than the non-pregnant patients. So the side effect profile of the vaccine in pregnancy itself is actually quite good. Of course, we're going to continue to collect all of that data. The risk of a severe reaction to the vaccine is no different in pregnancy than outside of pregnancy. So there's always a small risk of a severe allergic reaction to one of the medicine components. But as Dr. Greenwalt mentioned, it is extremely, extremely small. Right now, the literature looks like it's 0.001%. So, very rare to have those things happen. So I get a lot of questions about, is it safe in pregnancy? And so far, the data says yes. I can actually share the most up-to-date data from the VSafe app and go over that with you guys if you like. And let me see if I can share from my screen. Here we go. So hopefully you guys can see that. What we're looking at here are the VSafe registry outcomes as of the end of June, so we're still waiting on some of July's numbers. But if you look overall, miscarriage happens in anywhere from 10 to 26% of pregnancies, depending on whose data you're looking at. In the United States, it usually does run about 15 to 20%. And the registry, if you take all the people who've gotten the vaccine in pregnancy, the miscarriage rate is not increased. The stillbirth rate is not increased. Gestational diabetes, not increased. Preeclampsia, not increased. Eclampsia and growth restriction actually looks better than usual. Preterm birth, very much on the low end of the spectrum. Anomalies actually looks like it's less than what's typical. And small for gestational age or babies dying after delivery, all of that data looks very much in line with the general population, meaning everybody who gets pregnant has some risk of these types of complications, but for those that got vaccinated, it doesn't appear to be any higher. So that's all very reassuring data. I'm going to stop sharing now. The other issue that comes up a lot, and to Dr. Greenwalt's concern, is what does this do to my fertility in the future? So fertility, is more or less a question that came up out of social media, and to some degree more of a rumor than a medical fact. We cannot figure out any type of medical or scientific mechanism for the vaccine to actually interact with your ovaries, with your oocytes or your eggs, to cause a fertility issue. So medically speaking, we can't figure out how that could happen. And practically speaking, we aren't seeing it. In our large population of patients that have been vaccinated, we're not seeing a decreased reproduction rate. And even in all the patients that have had COVID itself, we're not seeing difficulty conceiving, which if you think about vaccines are going to give you antibodies to protect you against a virus protein. Even if you got regular COVID, we would hope you would have some antibodies, although they may not be as powerful against the virus's protein. You would expect to see some decrease in fertility in the COVID population as well as the vaccinated population. We're not seeing it in either. So far, the data is telling us that this isn't an issue. Are we going to stop collecting data? Absolutely not. No time soon. We're going to continue to collect data on all of these things. But there doesn't seem to be any plausible medical reason that it would decrease fertility. The initial rumor that came up around fertility had to do with a particular protein, and it was called syncytin 1, however you might want to pronounce that word. That is a protein that is present in placenta tissue, and it shares a tiny piece of genetic code with the spike protein that we're targeting with the vaccine. But the amount that is shared is actually pretty tiny. It's the equivalent of, let's say you've got a 9-digit phone number and you know one of those digits. So that would be like me saying, I can call this person because I got one of their digits and I bet I can figure out the other 8. So your immune system doesn't necessarily work that way. Even though there is a tiny bit of shared information, we share a lot of DNA and genetic code with a lot of things. If you look at human DNA, we share 90% of the same DNA as a banana. So that rumor that got put out there in social media was truly a rumor. We don't have any evidence that the vaccine creates an antibody that interacts with this protein or with any protein within placenta tissue, myometrium, endometrium, or any of our reproductive tract. So, you know, if fertility is a big concern, and certainly for a lot of my patients it is, we would still advocate getting vaccinated because the risk of the disease itself having long-standing side effects from that disease is much more likely to be impactful to your ability to get pregnant and carry a healthy pregnancy than the vaccine itself. So with that, those are the two main questions that I get all the time. Is it safe for me to get while I'm pregnant? Is it safe for me to get if I'm thinking of getting pregnant? While pregnant, absolutely, we have really good data that it's safe. This mRNA molecule cannot cross the placenta. It can't get to your baby. It's too big. It won't cross there. So the immune response it creates is in your body only, and that protects you and your baby while you're pregnant. So that's great. Those antibodies have been found in baby after delivery, so baby may get a little modicum of protection for a couple of months. We're still looking at that data. The main reason we recommend it in pregnancy is because our pregnant patients get much sicker from COVID. Because you carry a baby, because it changes your lung functions in pregnancy, you're much more susceptible to getting pneumonia and some of the very serious complications we're seeing with COVID. So because pregnancy itself is a high-risk state with COVID infection, we would really prefer to keep you safe. And if we're comparing odds of getting sick from a side effect from a vaccine to odds of getting COVID and getting very sick from that, there's no question which choice is safer.
Do you have a recommendation for what trimester a pregnant woman would receive the vaccine?
That's a good question. As of now, there doesn't seem to be any difference whether you get it in first, second, or third trimester. So there doesn't seem to be any increased risk of birth defects. The data actually shows a lower rate of birth defects for those patients that are vaccinated. So the ACOG, American College of OBGYNs, and Society of Maternal Fetal Medicine, who are also constantly looking at this data, has put out there that we think it's safe in any trimester of pregnancy. So I wouldn't say you need to target or avoid any particular time.
Perfect. Okay, that's very helpful. So I'm getting a few questions in the chat, and in just a minute, I'll open it up for those who are calling in on the phone. So the question about trimester was a question from the chat, and here's the next one. During delivery, if you have been vaccinated, are they finding more blood loss or hemorrhaging?
No, that's a good question, but we haven't seen any evidence of an increased tendency to bleed during delivery.
So if you've had COVID, oh, sorry, go ahead.
One quick question, which is that no one, I think outside the medical community doesn't get propagated as much as those in the medical community know, which is that COVID, the actual virus, creates a hypercoagulable state. And so you're more likely to get blood clots and lodge very serious blood clots when you have COVID. So I can imagine in pregnancy, you're already hypercoagulable, then you get more with COVID. And our cancer patients, they're also already hypercoagulable, and they get COVID, they also become extremely hypercoagulable. So while we've seen young patients who have actually, done okay with the virus at home, sore throat, runny nose, I have personally lost a friend and actually lost a patient who died a month later from a severe blood clot from the virus because of the hypercoagulable state. So I just wanted to bring that up too, and thankfully the vaccine does not do that and prevents you from the virus doing that to your coagulability.
Perfect. So a question from parents. So say they have a 12, 13, 14-year-old and they're trying to make the decision about their child getting vaccinated. Can you talk a little bit about how that might or might not impact fertility and how that should weigh into their decision as a parent?
Absolutely. So I am also a parent of a teenage daughter. She's 14 years old, almost 15, and I did exactly what Dr. Greenwalt did. I went to the studies. I started looking at the data. My daughter's vaccinated, and the reason why is that she loves sports. She's a soccer player, and she loves school. And even though she's going to a school where they're taking all the right precautions, there is no perfectly safe scenario to be around a large group of people with COVID spreading like it is currently. So for her, I thought it was a good decision to protect her. And by protecting her, I'm protecting everyone around her. I'm protecting her teachers. I'm protecting, other children that she encounters. I'm protecting my family members. And overall helping to decrease the spread of the virus through the community. Because again, we can't predict who is getting sick. And with the new Delta variant, we are seeing more symptomatic kids and we're having more pediatric admissions. So I personally made the decision to vaccinate my daughter, and she was on board with that. As far as fertility, we don't have any evidence, again, that there's an impact on fertility. I would be much more concerned about her having some of the long-standing after effects of a COVID infection, affecting her health overall, and maybe impacting that later on than the vaccine itself.
Perfect. Thank you. If you have an autoimmune disorder, can you take the vaccine? Dr. Greenwalt, do you want to talk about that?
Yes, absolutely. An autoimmune disorder is very similar to my patients with cancer who actually get chemotherapy and suppress the immune system. So this was actually a contention point when the vaccine first opened up to the public was, do we let patients who have autoimmune disorders or patients who are on active chemotherapy get the vaccine, right? Because a lot of my patients don't have an immune system, right? They're immunosuppressed from their actual chemotherapy. And so the national oncology groups came together and did subsequent studies on what we could very quickly. And what we found was that the vaccine was totally safe in patients with autoimmune disorders and patients with active chemotherapy on board. The guidelines actually say that as long as your patients aren't neutropenic at the moment, they actually should get the vaccine. So the majority of our patients, even under active chemotherapy, got the vaccination, did well. And I will tell you that thankfully here, we haven't seen that many of our cancer patients get COVID because so many of them clung to us, trusted us, and got the vaccine that they've done really well. Again, if you have a pre-existing condition to COVID, COVID tends to be more severe. So for reasons we don't really still fully understand, COVID likes to spread all over the lungs. And when you have an immune system that's suppressed, you're not going to be able to clear those infiltrates out of your blood and your lungs. And so that's why patients end up on ventilators, because they can't breathe. They need breathing support. And so I can't stress the importance of patients with autoimmune conditions, cancer, any kind of disease like that. I always tell patients, obviously talk to your rheumatologist, just like my patients talk to me about their oncologist about it. Obviously talk to your rheumatologist and get their way in as well. But the studies have shown, and again, we're talking about millions of people now, that the vaccine is still way safer than getting the virus.
Perfect. If someone is already having a high-risk pregnancy, would you still recommend that they get the vaccine?
That's a good question. Yes, and sometimes even more so, depending on what we determine to be their risk factors. If you are pregnant with diabetes or hypertension or morbid obesity and you get COVID, you are much more likely to need to go to the ICU. So if you are pregnant with underlying medical conditions, it's even more important to get vaccinated. I've had some of my patients ask me who are expecting a baby with a birth defect, my baby is going to go to the high-risk nursery. My baby's going to go to the NICU. Should I get vaccinated so that I don't accidentally bring COVID into the NICU? And my answer to that is also yes. If you're a high-risk pregnancy because of concerns for baby, and baby may need to be in the hospital a little bit longer, it would be wonderful to have some degree of protection against the virus so that you don't accidentally bring that in a time frame where you may not be having symptoms and transmit that in the special care nursery. So we're very supportive of our pregnant patients, particularly the high-risk pregnant patients getting vaccinated.
I'll just comment that that was me. I did have a baby in COVID in the NICU. There was no vaccine. And every day I cried walking in thinking, I hope I don't have it. So, I mean, what a blessing that they have this option, because I didn't have that option. And having a NICU baby, very tiny, very susceptible, it was frightening. It was really frightening, y'all. And so my heart goes out to any high-risk OBs out there. That was me. So I've lived it. I'm still here. My baby's doing great. So you will make it. NICU days are hard, but this is one decision you can do that really protects your family. And so I think that's the important message here too, is it not only protects you, but it protects your family. I also want to just hit one more question just in case we run out of time, which is, I hear this a lot. Most common question I get is, I've already had COVID. Why do I need the vaccine? And that is, it's a great question, and I just want to make sure we take a couple minutes to address it. So what we're learning about the natural immunity. So if you have COVID, you do generate antibodies. Now, we don't know exactly who or why. Some people generate more antibodies than less, but what we're finding is that the natural COVID antibodies really don't last. Some people, they wane by 3 months. Most people, they're gone by 6 months. Some people may have them linger, but those are the people who had more severe infections. But even still, the people who still have antibodies from their original COVID infections are actually getting the Delta variant. That's what we're finding, because the antibodies from the original infection aren't as robust as the antibodies generated from the vaccine. So the vaccine essentially is this inactive mRNA that essentially causes your cells to put a spike protein on the top of the cells. It's kind of like a marker, and that marker is a pretend COVID. It's not active COVID, it's a spike protein that says, look, I'm a foreign body. And so your body's like, what is this? And generates all these antibodies to try to fight that. And so what we know is that when you do that, thankfully, because of that cross immunity, the coronavirus is covered in multiple strains from the vaccine. So what we're seeing right now in the Delta variant is that the vaccinated individuals are doing a lot better because the vaccines are holding up against these new strains that keep popping up, and the natural antibodies from people who've had the virus aren't doing as well. And so right now I've told all my friends, I'm like, look, I really need you to stop and think about this decision, because you will likely probably get infected with the Delta variant, even though you had COVID 3 months ago. You can still get reinfected. So I just want to make sure I hit on that point, because I get that question a lot.
Perfect, thank you. It is noon, but I've promised the people on the phone, if they weren't able to type in the chat, that they can ask a question. So if anybody wants to unmute that called in, now is the time.
I have a question about breastfeeding and getting the vaccine. Is there any dangers with that while you're nursing?
No, absolutely no dangers with that while nursing. In fact, the antibodies that you make in response to the vaccine do not cross the breast milk. The mRNA itself cannot cross into the breast milk, so it's very safe.
Perfect. I think we'll do one last question. We'll go to 12:03 if anybody has a question. I know we've gotten some great questions in the chat. I'm going to try to go back to those and get you a response via email. But if you want to email me, wesleyroberts@bmcjax.com. If your question didn't get answered today, we'll find your answer for you. But we can take one more question before we close.
Dr. Greenwalt, I'm Punim Naki here. I have a question from one of my staff members, and the question is it too late to get the vaccine now?
You mean in terms of the current surge with the Delta variant?
Yes. Question is.
Yeah, so that's a great point. So that's actually why we wanted to do it right now. The health experts obviously have predicted that we're in a spike, but the Delta variant a month ago was 20% of cases in the US. As of today, it's almost 79–80%. So the Delta variant in 1 month has gone from 20% to 80% of our cases. If you can imagine that rate, it's going to be 100% of our cases in another month. So if you were to get one dose of even Moderna, so the vaccine generates not full immunity after one shot, but partial immunity about 10 to 11 days, the studies show. So I've been telling all my friends, go get your dose, go get your dose, go get your dose. Because believe it or not, I have one friend who got his dose in day 12, and he literally is struggling, but he said he feels like his antibodies have already kicked in, and thankfully he's not in the hospital from his one dose. So absolutely getting it literally today in 10 days could be the difference for you from needing hospitalization or not. Again, the Delta variant, the way it's spreading, especially in our area right now, our test positive rate in Duval County, I was reading this week, is up over 20%. It's only going to continue, especially as kids prepare to go back to school. So it's not too late. It's definitely not too late, and you can act now, and I think still have protection. So there are cases of people who get the vaccine and then will test positive 2 or 3 days later, and you'll see rumors on the media, oh, they got the virus from the vaccine. No, that's impossible. The vaccine is an inactive vaccine. What happened was they got the vaccine and they picked up the infection community, but thankfully the antibodies from the vaccine will start generating, but it wouldn't have been there to protect them from their infection. So yes, not too late. That's why we're doing it today. We'll continue to hopefully spread the message.
Thank you so much.
Absolutely. Thank you so much. Thank you, Dr. Greenwalt. Thank you, Dr. Villano. Thank you to everyone who came today. I dropped a link in the chat to vaccines.gov. It's an awesome link to find a COVID-19 vaccine near you. You can sort by vaccine manufacturer and zip code. So that's a great resource. We're also doing vaccines next week on Monday and Wednesday at Baptist Beaches and Baptist South. So check your email for information to that. And a link to this recording will be shared in the weekly What's Up newsletter that goes out to Baptist Health team members on Wednesday. So thank you again. I can't thank you enough. These are really, really great questions, really valuable info that you shared, and I appreciate your time.
Thank you so much.